at age 4 or 5 is when kids do great at the dentist. They love it. That's one of the fun parts of their week or their day. We help parents prepare their kids for a fun visit. We have a prize box at the end. We have TVs on every room in our office where they can watch cartoons. We even have a fish tank looking display where they can watch fish on the roof. So we're happy to see them.
Now, you mentioned something about children, that you see lots of children. So, what age should parents actually start bringing their children, and should they bring them, uh, when they teeth, when they're not? Tell us a little bit of like how parents should prepare themselves for their children, type of all the way till they're like kind of teenager. Give us some big overview there.
Yeah, we recommend parents bring their children in as soon as they have teeth. So that may be anywhere between 6 months and 1 year. And that gives us opportunity to work with parents and give tips on how to brush their teeth at that early stage. If we see them before age 3, they get a good, easy, fun visit. If their first visit is 2 or 3, they're a little bit more opinionated, and we have to work with them. We can work with them if they come in for the first time at age 2 or 3. And then at age 4 or 5 is when kids do great at the dentist. They love it. That's one of the fun parts of their week or their day. We help parents prepare their kids for a fun visit. We have a prize box at the end. We have TVs on every room in our office where they can watch uh, shows or cartoons or nature shows. We even have a fish tank looking display where they can watch fish on the roof. So um, we're happy to see them. On the 2 to 3 year olds, yeah, we got to move quick. So those are a quick visit. We actually have a great technique to have kids sit on mom's lap, and we call it a knee to knee exam for kids anywhere from age 6 months to about 3. We have them actually sit on mom's lap and even face mom, and they lay the child back down and on the doctor's knees, or a um a
Hello,
a
so
little towel that goes on our knee, and then their head lays on the bib. We put a bib down there, and the kid can lay their head there, and work quick. We can work great with kids and enjoy seeing kids and whole families. We'll see whole families in my dental office. You don't have to have some kids go to a pediatric dentist and the adults come to see me. We see all ages in my dental office.
I'm sure kids love that, and so do parents, I think.
Yeah.
It's very good. I mean, I even see it when which I actually just did today. A friend who is housing with me for a few days, he comes from a different country, and he got a toothache. It's very nice to walk into the dental office, you know the guy, and you say, "Hi, doctor, I have a friend here. Can you please?" And you walk away again, and it's good. So let me ask you. When I grew up, it was a very long time ago. My parents and just even the dentists, because the dentists I had, I remember, was also the MD. And I do remember when he checked your teeth, whether something was wrong, he took his mirror and he turned it around and he hit the freaking tooth. And pretty hard. And the one where you went, that's the one he then pulled. So,
Yeah.
so it's long time ago. Uh, but what is the reason to worry about the baby's first teeth kind of coming out, not coming out, because they all fall out anyway? Well, what's the real big deal there? Why do children have to go to the dentist, especially if it is sometimes maybe not even hurting because the tooth just is leaving? The tooth fairy comes and picks it. I mean,
Yeah.
is there a reason?
So yeah, some parents think that you don't need to keep baby teeth, or if you lose a couple or big cavities, just pull them out, no problem, or don't treat cavities. And I would disagree with that philosophy. And the reason is because your teeth set you up for the size of a jaw that adult teeth would come into. So if you lose multiple teeth as a child, your adult teeth won't have as much bone to grow into. So the bite can be collapsed. You can have teeth crossing over each other, and your teeth are more likely to be crooked if you lose teeth, have cavities, and don't take care of baby teeth. Also, another reason to fix um, baby teeth is because they can spread. So you have some adult teeth come in actually before you lose your first tooth. Most people lose their first tooth at age 6 or 7, but we have some molars that come in that are called 5-year molars. So if you have 5-year molars come in that are permanent teeth, you don't want those teeth exposed to bacteria and cavities from rotten baby teeth. That's a recipe for having cavities almost the rest of your life. If we take care of cavities when they're in baby teeth, we remove that bacteria, remove that infection. Then when the 5-year molars come in, they won't get cavities. If we have taught parents how to brush their teeth, the kids brush their teeth, or cleaning the teeth, you can live in this day and age where you never get a cavity your entire life. That's a possibility. Most people don't believe that either. That it's possible to never have a cavity your whole life.
Well, I didn't know that either. So basically, I heard about that, what you say, the crowding, if like a permanent tooth comes out too early while the other ones are not gone, or the other ones goes it falls out too late, whatever it may be, that then it kind of like has a more chance of getting crooked. So now you need to fix them with braces more than other ones, type of situation. And that I kind of, that word has spread. But what you just said, that the baby tooth is in there, it might potentially be already kind of half rotten. It's about to come out, but it didn't, whatever, you know what I mean? And it has some infection, and then the new tooth gets kind of like, and all of a sudden you have that in your mouth, and because of that, you have cavities, you have infections, kind of like all your life, and you wonder why.
Yeah. Yeah, we call it from age 6 to, well, actually age 5, if you get your 5-year molar, from age 5 to about 11 or 12, we call it a mixed dentition. So you have some baby teeth and some adult teeth, and in the midway point, half and half. So you have a lot of adult teeth that haven't come in yet, even at age uh, 7, 8, 9. And so you can have bacteria spread from one baby tooth to the adult tooth. And that's why we want to prevent that by treating the cavities when they're small and easy to fix.
Very interesting, very interesting. Thank you, Dr. Carl. Thank you very much. Very, very, I'm sure that moms be very happy to know that.
Yeah.
Even the dads,
Yeah.
but moms. All right. Well, good. Wonderful.